Good morning, everyone. I'm going to now present the study that we have done in India, examining the impact of RHANI wives intervention on reducing marital conflict and sexual coercion. So this is, to our knowledge, is the first study which has a robust methodology for evaluation and also has demonstrated the effect. And I'm here representing a team from both the US and India side. And this project of RHANI wives intervention is primarily to reduce the HIV risk among the married women, because way back in 2008, when we were talking about this whole issue of intimate partner violence and its role in HIV infection, some of the work that Dr. Silverman has done from India, at that point of time in India, 2.07 million were infected with HIV. Of those, 39% were among women. And 84% of the new infections that were occurring among the women were primarily within marriage. And the two significant factors that came out was, one, the intimate partner violence and husband's heavy alcohol drinking. At that point of time, there were no interventions primarily targeting reducing the HIV risk among married women. There were interventions with the men, but then the men with highest risk behaviors, for example, the heavy alcohol drinking, the intimate abusive men, are less likely to participate in any intervention programs. So this primarily, the RHANI wives intervention was created to work with only women. It's a multi-level intervention with an intensive community campaign in both the intervention and the control clusters, whereas our intervention is primarily targeted at the woman to build her skills in self-negotiating, or to self-identify the formal and informal resources around her to deal with the issue of the abuse that's happening within marriage, or the high-risk behaviors of the men in order to reduce her own HIV risk. So this is a picture that is showing an intensive campaign that we did in both intervention and control clusters, and that's a standard program that went into the communities, and it has no control, but what we did was with the women to really use some innovative methods of communication and building her skills to self-negotiate and identify the resources around her. And what results that we have seen was that we have used a randomized control trial in this case with baseline and 3-month follow-up, and the result shows that the effect of intervention on physical violence has reduced both in intervention as well as in control communities clusters, which means that the difference between intervention and control clusters in reducing the physical violence was almost minimal. Why? Is because, as I told you, that the intensive community campaign, and our major focus in that community campaign was that the violence is unacceptable. And that has been the tagline following the intensive community campaign. Discussions with the key stakeholders has really helped to our knowledge. But when it comes to the real impact, we see that in the sexual coercion or the sexual violence, where the women who participated in the intervention, or the women who belong to the intervention clusters, have reported significant reduction in the sexual coercion as compared to the women from the control clusters. And that result points out to the effect of the RHANI wives intervention program. And the same as the results for the argument with husbands in the past 3 months, the marital conflict. So in summary, what it suggests is that unlike a conventional or the usual practice of doing an intervention with the men, when the men are really abusive, our intervention has shown that even working with the women who are really in that situation of where the husbands are highly abusive, working with the woman to build her skills to self-negotiate, it can have several corollary benefits in addition to reducing the HIV risk and promoting condom use within marriage. Thank you. And lastly, I would like to acknowledge the collaborators and specifically our funding agencies, the Indian Council of Medical Research on the India side, and the National Institute of Mental Health with Willow Pequinet is our project officer from the NIMH. And I would like to thank all of them. Thank you.